Right. So I'm Vahdet. I'm a consultant psychiatrist and chair of child psychiatry department at Bezm-i Alem University, just down on the road there. And I'm also a board member for Doctors Worldwide. Great, it's better now. So Mr. Şentürk said, so you are here as the embodiment of the soul of Kerem Clinic here. I said, well, there's a mismatch of the size, the capacity here. Okay. So actually, Kerem Clinic really is a huge personality. So I'll try just to do my best to just give a brief talk about what we have done here so far as Doctors Worldwide, what we are aiming to do. And in the end, which is my field, is just talk about the psychosocial support team of Doctors Worldwide, what we have done. I'm going to talk about a really very interesting project that we initiated in the last year or so. Great. So Doctors Worldwide is a 15-year-old adolescent, but mature, thoughtful, and considerate of others that are disadvantaged, that are hurt, that are poorly and in need. So we were established in the UK in 2000, and then in 2004 the Turkish branch was opened, which is now an independent unity. We have our own board that's independent of the UK branch, and also in 2009 there was a Pakistan branch opened, which they work together with the UK branch, the UK base. Then we have since a few other local branches that has been established in 2011 in Somalia, in 2013 in Kenya and Congo, and as of last year in Palestine. So our mission is on the way of goodness for a healthier world. We all are here with the same purpose, all these agencies, humanitarian aid agencies and others, just to share the burden of these people who've been suffering really lots of traumas and everything on different parts of the world. And our vision is just to be one of the authority agencies, NGOs in the field. I think, just despite 15 years of the past, I think we are hopefully getting there. So we have got lots of partners that are some UN agencies such as UNICEF, some unities like FEMA, and international NGOs such as MDM, IMC. These are the, MDM stands for, as you all know, Doctors of the World, and IMC stands for International Medical Corps. So we have local partners, universities. My university is one of them, and TICA, AFAD, Ministry of Health, and Turkish Red Crescent. So what we aim to do is just not only to provide medical care and humanitarian aid in emergencies, in crisis, but also to create local resources that the local people can further build upon. And to take initiative to restore medical education, which I'll talk about a bit, and build local hospitals, open training centers in general. And doing this with paying no attention to the color of their skins, their religions, their ethnicity, remoteness, and political affiliation. We've been into Philippines, Nepal, Syria, Iraq, and elsewhere. Wherever there's need, we like to be there. We strive to be there. So Mr. Şentürk said these are a bunch of crazy guys, crazy doctors. They pay from their pockets to spend their holidays in Africa operating on people there, which is true actually, that these people pay from their pockets. Instead of making money in the private clinics, they go there, stay for weeks, and take medicine, take milk formulas, whatever, money with them, just to distribute, just to share a bit, if can, just the burden of the people that really they've been going through. So I'm just going to go through this a bit quickly because it's like it's not my area. I've just been given 2 days notice to give this talk. So I don't have much preparation, but just to quickly go through this, and we'll come to the psychosocial support project that I think will be really interesting to talk about. So our areas of activity are emergency and disaster aid projects. As I said, we've been doing this for years and in different parts of the world. Preventative health projects, treatment health projects, capacity building, and health education projects. So this Yamadi Hospital for Syrians is in so I got this English names here. That is in the Syrian border. Actually, it's been there for many years, but kind of demolished and not actively working. So we took initiative in 2015 of just January, only a few months ago. That is in the port city of Latakia, and that provides care to around 100 surrounding villages and 50,000 people. And we've got 47 people working there on site. And also we have been, this is Turkish, sorry. And also we've been providing some financial support to contribute to the wages, to the salaries of the doctors, of the professionals working there as well. And also we send doctors from here who go there and stay for weeks to deliver the aid. So this is a similar one that is in Somalia, Al Shifa Hospital, that we contributed to, and Tembo Medical Center that is in Kenya. It's again really very poorly area. The daily income of them is just under $1, and there are 30,000 people that the hospital has been serving to. And this is a similar one that is in Pakistan. That's just is maternal and newborn care program that started in May 2011. So this family community care package that focused on 3 areas: educating and counseling women about breastfeeding, about eating properly during the pregnancy, providing clean birthing kits and micronutrients. As we all know that the folic acid deficiency is very important. That can lead to several neurological problems. That's really crucially important just to provide that, and training local traditional birth attendants. So for the last 3 years, we've done really, you see the numbers, that's some work that I think the people there should be proud of. So Hewa Bora Hospital, that is again in Kenya, and we get daily reports from them, and we've got a report from today that today there are outpatient clinics. And this is a fully functioning hospital with some operation suites as well. And we've got obs and gynae patients. We've seen 30 patients today, lab facilities, 50 pediatrics, 49, and there have been 11 cataract operations. As you can see, there's every day almost 10 cataract operations being carried out. So this again a similar facility in the city of Gaza in Palestine. And this Habib Medical School is very interesting that really we are now contributing to it actively, starting from the curriculum to delivering the training, and the medical students there come here to do some elective courses, for weeks and for months here. And we carry out the academics here in our universities in Istanbul, in Turkey. They go there to carry out examinations. So just to provide really a first quality medical training. And also again, this is what I talk about a bit. And this is psychosocial support program. That is my field. I can't talk about it really without the slides. So I came from the UK, where I stayed for 12 years, to Istanbul of August last year. When I came, I became a board member of the Doctors Worldwide, and there was a lady who was the headmaster of a school, a Syrian refugee school in Istanbul, and she came and she talked about the kids, the youngsters they see in their school that's been really traumatized, and they can't cope with it. So they just sought help from us. So I went there with my colleagues. The trauma really is immense. The young people got lots of physical damages to their face. Beautiful girls been damaged really physically, and kids disturbed. They can't sleep. They got trauma symptoms, nightmares, and they feel alienated here. They feel that they don't belong here, despite having more or less similar cultures. Really, religiously we are the same, and not very far cultures. So, and actually we said, look, I mean, they came to us and we have to do something about it. So psychological help, you can't do it with interpreters, really, That your mother tongue is the language of your emotions, of your fears, your aspirations, so you can't do it with interpreters. And also, even if you want to do it, we don't have facilities. We don't have trained people who can deliver therapy. So actually we said, okay, let's do something that is unique. So we developed a training program, a treatment manual that's of 90 pages. Actually we said, look, we can develop this program and train teachers who can deliver the training. It's 8-session, 10-session psychological support program. So actually we did it, and then we went to that school. It's called ILAF School, and we named the project ILAF Project, and we trained the teachers. Really, it's heartbreaking to see the teachers in the training, that when you talk about a safe haven, a safe place that you can really seek refuge when you feel threatened, when you feel whether there's a fidelity to our program, and it went amazingly well. We gave them lots of questionnaires to do pre and post to see actually whether there's something that we create that is effective, that we can take it elsewhere to run the program. So actually we asked questions such as, do you have any hopes that the war will come to an end? Any hopes that you will go back to your country? Have you seen anyone being killed, shot? And have you lost anyone from your family, your dad, your moms, your relatives? Those who answered yes to this question their trauma is vastly outscored that of others. And following the program, the training program, actually, these scores have come down dramatically. That's very important to show that actually, really, we can create resources from whatever you have in hand. And teachers can do it extremely well. They do it in their natural environment. The kids do it in their own schools and get guests from people whom they trust. So that's been one of the main social support programs that we've done in Doctors Worldwide. And there's been some really interest in it, and we're hoping to take it to Gaziantep. It's one of the cities in the south border. And we've been asked to deliver to 17,000 people, kids there. And that's our aim, to take it there next time. We've done in another school in Istanbul, more or less same results. So really, the psychological, actually what's interesting thing that I want to share with you is that when you look for fund for opening up a hospital in, say, Kenya, you get lots of fund. People donate, are generous. But when it comes to really, finding fund for something like this, people are not as eager, really. That's very interesting. I don't know why. That they say, look, I mean, there are people who are losing their eyes, so cataract surgery is better than just, it's just helping these people who've been traumatized. But trauma really can shake people from their roots, from their grounds, really. It doesn't only affect the child, the whole family. So that's been one of the things that we've been doing, and we hope that we'll take it further. Thank you very much.